Hi again, everybody, and welcome back to Justice Reinvestment. This is the third episode of my podcast, which is primarily around what do we want? What is justice reinvestment? Well, in a nutshell, it's understanding how we can better help people that have substance use and mental health disorders, and how we need to modify, change, redirect, reinvest, and reinvent our criminal justice system to deal with people that have behavioral health and substance use and all these other complexities of life that we deal with. And today, it's just such an honor to have with me Jennifer Mackey. She's my sister from another mother, I say affectionately, and we are that at times, and at other times you can tell we must be siblings. Uh, we've been together since when, Jen?
December of 2013.
Wow, you remember it. I forgot it for some reason. But I know it's been a wonderful journey, and there's so many things that Jen and I just coalesce on, just match reality on, and our experiences. And so you already know, most of you guys know what my road from childhood to chemical dependency to prison looked like, and how I got out of that miraculously. And I'm kind of, if you'd share with us, Jen, kind of what was your road from to 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 bring you to this area of work that you do today, and what do you do today, and kind of share some of the work you've done.
I grew up in a small town with an alcoholic father. And so I was always curious why. I can remember I crawling up on my mom's lap when I think I was like 3 or 4. And I said, why does daddy act like this? And she said, because he's sick. He and
Your
I
mom even
My
knew that.
mom, yeah, and I thought to myself, well, sick, I guess he does throw up sometimes, but I didn't really understand, and so we lived in that household. A lot of violence. Cops were at my house a lot, and knew him on a first name basis. And I had a lot of respect for law enforcement at that time
Now,
because
your
they
your
came.
dad your dad was a truck driver, right?
Yes, he was a truck driver. He was home most nights. However, good or
Some
bad. But so law enforcement was in my house a lot. So they'd come up and rescue me because I'd take the poodles and hide in the bathroom. When the cops were on their way and to get him. And so I had respect for the law enforcement because they saved us.
Now, I have to interrupt because you always have this line that we used to always say, and I'd always have it. But her father, guys, used to come home at 3 o'clock in the morning, have mom get up and make a mistake, and brag about that he drove more miles backwards than most
It
people.
was I've backed up more miles than you'll ever go forward.
Okay.
And that is a common phrase that my family, not him. I have not had contact with him and since my brother passed. I saw him at the funeral, like 20 years ago. He
Yeah.
hasn't been in my life, but no. So I had a lot of respect for the law enforcement at that time because they kind of saved us. There wasn't a mandatory arrest law back then, so they would take my father and haul him away, and he would walk back, and it was always then he threatened to drive through the house type of thing, and there was just always that kind of stuff. So when I got older, I myself did not even graduate high school back in the day. So I tell my kids that I see now all the time because I had a little bit of an attitude.
Yeah. Two
I,
people
I
that
was
had to
I
wait till later in life to
Yes,
kind of
to
grow
get their
up and
crap together
yeah,
because
right.
my brother was kind of always on it. He knew he was going to be a lawyer, was a lawyer. I was kind of the other kid. I was the kind of daddy's favorite and used as to kind of piss other people off in the family. So anyway, as time went on, I was kind of angry. So I, eventually, I skipped school a lot. 2 weeks before graduation, I told my assistant principal, I think that's what he was, to have a nice day, and walked out of school because he made me mad. And so, and that's what I tell these kids, that didn't really do me any favors. The guy didn't care, he went home.
It didn't
But
impact him
yeah,
any.
I'm like, but anyway, so I kind of floated around and worked at Hardee's and that type of thing, and dated idiots that smacked me as well because I mean that's what I was used to, alcohol and that kind of stuff,
Abuse
and
and
yeah, abuse. And so finally I was like, dang, like this kind of sucks. And I remember the day that somebody came through the Hardee's drive-through, and it's got a carload of kids that I went to school with, and it was probably like 2 or 3 years after I graduate or should have graduated high school. I did get my GED. I did get my GED right away though, because it wasn't about intelligence. That's like just like other kids. It's not
Yeah,
about
right.
intelligence. It was about the moment. But so I thought, why am I serving ice cream cones to the people that are home from college in the summer? What I could be that. And so eventually, I did go to school. Well, I fell into criminal justice classes because those were my people. I knew that class was easy. So I went through, ended up getting my undergrad and master's coursework in criminal justice. I got out and like, what do you do? What do we do now? We don't really do anything with those degrees, and except become a cop. And I earlier had the respect for cops because they were saved the babies. So I became a law enforcement officer, a sheriff's deputy. And what I learned when I was a sheriff's deputy, I didn't care about arresting people. I got no joy from that. I got what I wanted to know is why. Why are people living under the bridge? Why are people smacking people? Why are people, on drugs? Why are we where we're at? So
What's a solution?
this well, yeah. What are we doing? How did we get here? So I thought, well, it's addictions.
Yeah.
Majority addictions. So I went back and ended up getting my master's in addictions, and worked inpatient, outpatient substance abuse for a few years. And what I then learned too is primarily from you when I started with you is it's the trauma, it's the mental health issues, it's all that stuff that started
It's the
the addiction.
anxiety, the
Yeah.
depression.
So then we had the mental health issues that led to the addiction, which led to the criminal justice. So I went
You
back and
see
got
it
my
all
master's.
intertwined.
Yeah. So I went back and got my master's in social work. And so that's kind of the path I took. I've done a bunch of different
And it
stuff.
really related as you got into it more. And it was really hard for you in the beginning, because given that criminal justice background and, Pete was all blah, blah, blah,
I
and
thought social workers were soft
yeah,
because
yeah,
that's what we learned in law enforcement. Like, oh, these are the ones we go arrest all these people, and then people get them off.
yeah. The social
And
workers get them out of it,
yeah,
right?
and they're bad people, and so it was kind of it took me
Well,
a little bit to kind of flip
Jen,
sides.
and what we say today, and I work with Officer Nate, the homeless guy that homeless outreach team. I hope to have him on here sometime. But his book is just amazing. What a homeless person taught a cop. And I'm reading his book. I'm like, damn, Nate, you're a social worker. What the hell? And but really, it just really is about marrying this. That's what justice reinvestment to me in large part, is about. Is marrying. How do people need intervention? Okay. But what's an effective intervention? The point of diminishing returns. I mean, our current system is insane about just the punitive side of that. But
And that's true. If I would have had somebody, I do a lot of work in schools, high school right now. If I would have had an intervention, if I would have had somebody, if I would have had something in high school, my life would have turned out. I wouldn't have wasted 10 years. I would have graduated with my class. I wouldn't have been as
mhm.
angry. I mean, I could have very much went down a totally different
It
path.
was how you were
Uh-huh.
treated,
Oh yeah.
and
What was going
people,
on?
and which is one of your areas of expertise is really matching people's reality and meeting them where they're at.
Yeah.
And really understanding that from that perspective. So anyhow, like it's kind of funny, you when you were at the Caring Center of Wichita, going way back 2013, 14, we used to laugh. You'd have somebody that was kind of an intellectual, and they were more like they weren't criminal, right? And they weren't justice, and I'd like they're here for Jen, right? And you would be like, these are my
These are my people.
these are my people. These are my babies.
Babies.
Yeah, and you just really got them, and I always loved it that they'd come in, and we always say more will be revealed later, right?
Yes.
So what is it whenever they would come in and they would start running some story that was obviously hiding a few things, if not a lot?
Well, yeah, we would get into what brought them in, and the majority of them were court ordered, and I loved that population, like I said. So, and they would start telling me, and I would be confused. So, because it just didn't make a lot of sense. So I'd always the joke kind of line was, "Well, I'm confused. You said help me, or help me
Yeah, help me
understand.
understand this.
Help
I
me
think I'm
understand
missing
because I'm
something.
confused."
Yeah.
and just to guide them, because I mean I think they grew up living their life of they've got to manipulate, they have to lie, they
And they
have to
have an
cover.
image thing.
Yeah, they have an image, they have um you know uh, and so we meet them where they're at and let them know that, hey, I don't care, like I've probably done it myself,
Yeah.
or know somebody that has.
And when
And
you were working with kids, you always told me, Peter, just, I'd adopt them all, but I can't adopt them. I
yep.
can't, but, they don't get their value, right?
And that's what I work on 100%, is that respect. And they don't often have a lot of respect given to them. Sometimes they're in some homes where there's no respect, or they end up in the criminal justice system. So they have probation officers or principals, or, their own parents, whatever, everyone telling them they're bad. They're bad, they're
Hmm.
bad, they're bad. So
And punishment. Yeah.
punishment,
And you're
and
going to get this if you don't.
yeah,
Yeah.
and you're just you can't do anything right, you're whatever. So they believe that. And that's kind of how I was as a kid. My brother was the good one and I was the other one. And
So they're going to
so,
fulfill that
well,
prophecy.
yeah, and then you're going to keep going. And so then when we're at school, if you get in trouble, you act out, they're going to kick you out. Then you're labeled you bad. So then you're going to be the bad kid. So then you continue on that path. So, just finding their self-worth and finding what their strengths that they don't even know that they have,
Yeah.
and showing
It
them
makes them, it's
respect.
really an uncomfortable thing
It
for them.
is. And showing them respect, because they haven't gotten a lot of respect
And
sometimes.
and like a lot of people would say, well, if they're, I've heard, I hate this comment. Well, if their lips are moving, they're lying. I've heard a lot of people in probation, and a lot of them are changing that mindset. But, you and I just meet them where they're at. I mean, that's what we can do. And I'm going to take everybody at face value, and then more will be revealed later.
Let's try to
And
be
so
innocent until proven
yeah,
guilty,
yeah, let's
instead
try
of,
that.
yeah,
And what
instead of,
does it hurt if I'm wrong?
yeah.
Okay. Do I have to be right that I knew you were that way? Because, I watch this craziness with this, some of the DCF stuff and whatever. And I just decided in some cases, like, and with this is going to happen in law enforcement too. And with our courts, they get an outcome for the patient and then they drive everything for that outcome, right? They meet that circumstance rather than let's just meet them where they're at. So this is part of justice reinvestment. Let's don't do that. Let's take them at face value. So what? They're a little bit, they don't have the courage to be that vulnerable to share some of the really, intimate stuff of their lives that's hard to accept. I know, and so they can't get to empowerment because they're always in defense mode because it's too much shit to own. And, they're always on the defensive, right?
Yep. That's their game. And I think that kind of goes in, like we were talking about just yesterday on the phone, is that we individualize. At the caring center, we're big on individualizing things, and I think sometimes, like with evaluations and assessments of these kids, what I see a lot is that we're on a checklist. People, they'll go to places, and it's like, well, here's a piece of paper and you've met all these check marks, so therefore you're this.
Yeah.
We're labeling you this. And I don't think a lot of times that we look into each question and why they answered that way. What
Yeah.
individually, why did they answer yes to this? Is it because there's a big difference in why people answer questions a certain way. And if, without knowing more individually about that person, whole different outcome.
Yeah. Well, like I just was telling you on the way over here about one of my patients that was a no call, no show to one of my providers, mental health providers, medical provider, and it drove me crazy, right? We went through all this and she didn't show. Well, her anxiety was through the roof. And I was telling the provider, look, thinks she's going to be drug seeking. Okay. She can't just be going in and saying, like my husband was in the same car I was in and somebody drove across the road and hit into him and it killed him and my 1-year-old and my 3-year-old son. My 1-year-old son was injured and I have a developmentally, a delayed child from this accident. And my life has been nothing but trauma. And so no wonder why my anxiety is 12 out of 10 or a 10 out of 10. And so, it's like, and no wonder why she went through some substance abuse, and so right away she's feeling like she's defensive
Yeah.
and it drove me
She's going to
crazy.
be
And usually I'm
judged.
pretty good, but I'm like, okay, let's, the why, Jen, the
The
why,
why.
why didn't
Why?
she show up for that?
Why? Everybody's got a different why. Why they make the decisions they do, why they answer questions that they do. why they, end up where we're at. And we need more individualized instead of being on a big checklist.
Yeah, and meeting people where they're at, and we don't know. Sometimes it's more, less is more, right? And we look at people and say, okay, well, if you've got this job, I don't want treatment to interfere with that job. This is going to build you up. This is going to give you not only the finances. Sometimes that's down the road. Their self-esteem, their self-worth, their routine, their structure, all the things that this can bring them, with their recovery. Because how we look at this is a very holistic thing. I had a kid last night that I was working with, and he had drank. He's trying to get a heart, and he has had a bad heart since birth. And some things came up, and he shared with me some really tough stuff from his adolescence, from his youth, really. And anyhow, everything came on. He got overwhelmed. So then the caregiver found some alcohol and this and that. And so then they went to the doctors and went whatever, and they were like, okay, we're going to take you out. I'm like, okay, well, no, there's a reason why you did this, why all of this stuff came up and how he responded to it, right? And so what we did was sit there and just talked about, it was a good intervention. The hospital did good. Grandma did good, because what we decided was to kind of put him on hold for like 7 months, okay? So me and that kid sat there, and he said, I've just been living my life like I was going to be dead at 16. So it's always been my mortality that was in, where I'm at, which is the same thing with some of our kids. That you talk about having, cheating death and having a low value on life, right? And so anyhow, he was overwhelmed with the operation coming up, the heart transplant and everything. So I'm like, okay, let's just take this, like he said, step by step. And then let's move back and find out, what's your next life? Like, I got a new lease on life. I got
Yeah.
out of prison. What is that? What the next step is getting your operation, but then you have purpose in life. I mean, the kid just fell apart when I told him, he says, I don't, somebody else will go, kid, you're 6, you're 8, you're 17, 18 years old. Nobody deserves a heart more than you. You've lived this way for all your life. And now you get a chance to live a new life, and you're building your foundation. And, he goes, nobody's ever, and I'm not bragging or nothing. I'm just saying it was an obvious fact. And what's crazy, Jen, there's a lot of things crazy, but in the criminal justice system, they teach people that, when I was working with them at the Day Reporting Center, what works, okay? Well, positive reinforcement is 3 times more effective than consequences, okay? So, and they did this in a really high security prison in Memphis, Tennessee. And, whenever they compared that, they got this reinforcement to consequence. Well, these guys have had consequences all their life. And so, like, it's free money for us as therapists to go, man, you rock. That was great. And watch them light up. And, that's where we're going to get our mileage. We've got to identify their strengths.
Yeah, and then that's what I did at the schools, and it's amazing. And it made me
Well,
just immediately think of
Jen, I
that.
want you, if I could, to kind of um, talking about your pilot program that you worked on. Talk a little bit about, okay, your work. You were full time with me and that. And then you kind of started. You were going to college, and you transitioned into a hospital social worker, a school social worker, a Caring Center of Wichita social worker, the whole 9 yards. I just love your background, but kind
Yeah.
of share a little of that and what you're
Well,
doing today.
okay. I started out doing the inpatient, outpatient, that kind of thing, substance abuse. Then I started with you and integrated the mental health into it as well. Did that, and then had
And
worked
not to
six
mention
years.
teaching at Wichita State,
Yeah, I
too.
did 6 years at a hospital, which I saw a lot. It was great because they come in and they're overdosed, or they're been in a domestic violence situation because of drugs or alcohol, or whatever that is, suicidal, those type of things. So I got to kind of be on the front end of that and do that. I worked in a school most recently for 3 years. Started a pilot program the
Now,
last couple of years.
before you went to the school, though, weren't you, like, I know when you were working with me, that you were teaching at Wichita
Yeah,
State in the
addiction.
addictions classes,
Yeah,
right?
I taught addictions for 3 years. Loved that, and I was pretty passionate about that because in the social work, field, there's not a lot of people that want to work with addictions.
Or know how to.
know how to. They don't want to, and they don't, or they don't how to do that. So, um, so it was imperative to me to kind of be that person that kind of taught that addiction, so that I could teach. This is the neuroscience. What you've taught me, the neuroscience of addiction. This is why. This is how, and really get them to be out of the box thinkers and
To understand
individualize
why people are doing
that,
what they're doing,
and to
right?
not be like, this is kind of that checklist thing again. We don't this all addicts don't
Yeah.
do this. Everybody that has a DUI doesn't need this. I mean, to individualize it and get
And
into
really
whys.
understanding them that isn't, we don't, the addict, it's a patient that has this, disruptive critical brain structures that controls judgment, decision making, and behavior. And that's the reason they're doing this crazy shit in the face of catastrophic consequences.
Yeah.
And, I want to talk a little bit about this. We talk about there's just such a huge shortage. So anybody shortage of clinical, but not clinical, but clinical addiction social workers, but social workers in the addiction field that understand this stuff that you teach, that
Right.
I teach, do seminars on, understanding brain, how that works in the brain. And so they come in, they want to, like this kid yesterday, that I told you, I could have said, when are you going to, you're not going to use again, you're not going to do this or that. I just talked to him about, well, he already knows about the brain stuff and that, and how he's imprinting these same memories, into his brain that are will drive it. And his dad, of course, he's an alcohol use disordered person really severely. And so, and his, so anyhow, that way of looking at it more holistically and tying those behaviors into the brain. And, I want to kind of, even though I ask you, I'm going to tell you about, I talked about this and it was really upsetting to me, that, I lost my child lost her mother, and she had a background. She was a nurse, an RN, a great RN, did great work and everything. But through that all, she had a doctor that overprescribed her, and a couple of them. And my child ultimately lost her mother on August 17th, 2017. And so anyhow, soon after that, one of my former supervisors I told her, and she was really shook by it all. And she told me I should get on the opiate prescription drug task force, or Partners for Wichita. So I got on that, had a real passion. And I think it was Reverend Dave Fulton. He was amazing. And I'm down there watching it. And this guy's like preaching to the choir. They already know about addiction as a disease. And, the guy was just amazing. And the whole thing, the people were amazing. And so there was one of the guys that was on it. There was from the health department, all these different areas, and they were so it was there was a guy on there, Ron Rosales. He was on the Wichita School Board. So I told him I would love, and Knock Bond was another person, and he's been on the school board recently. And Knock just got his doctorate in I think community work, and amazing young man. But anyhow, they got me in front of the Wichita, the USD 259 school board to present the possibility of initiating and implementing a science and evidence-based drug education curriculum. Because, Jen, we don't do groups at the Caring Center because we know adolescent groups, they just talk the same shit. It puts them into a peer environment, we feel, that they can't, it locks them in there.
And what peer wants to talk about their emotions and feelings
In
and
front
be
of other peers.
vulnerable? Yeah, in other front of peers,
And then they go out on break, and what
be
they're going to talk
friends.
about, be macho, and how much weed you smoked, and blah,
make
blah,
new
blah.
friends. And
Yeah.
So no.
And so no, and so what I learned was when I started the Caring Center, and I'd worked with adolescents years before, and I was kind of like scared about it. Like, well, I've been working with these bigger kids, right? All these years. And so anyhow, I'm finding out when I'm teaching them about the science of addiction and why they do what they do, and they're telling me blah, blah, blah about marijuana, and I'm telling them blah, blah, blah about the science, and we're having these great conversations. And all of a sudden, it's up to them. Okay, bro, now you can make informed decisions. So I seen where they had this curriculum that in the metro areas was really, really effective. Okay. So I was introducing this to school board. And I was so nervous and so excited same time. And I got there, and I've never, I've been to the Kansas legislature on different times testifying, and it was like a helium balloon. You come back and it's been punctured, right? And it dropped to the ground, and people would ask you questions like, where in the hell did that come from? How'd that have to do with that? And all it was evasive and not wanting to do it. Okay. and never get, what the hell, did you hear anything I just talked about? And so anyhow, when I went there, there was a dude that was running the main thing, and all he did was look at his watch, and he made damn sure I knew I had 3 minutes. And he kept kind of letting me know that throughout it. And so, I'm presenting all of this stuff about how much more these kids can gain if we had them in middle school and we started teaching them about how, no, not, this isn't your brain on drugs, this egg, right? This is how this works, right? And this is why you like marijuana so much. And this is how you could become easily dependent on it.
Well, and they have those programs, I think, is it Dare? Just
Yeah.
ridiculous to me. And I think it's a good, maybe an extra, but
It's great for the kids that are
the
already
little
there,
kids and like,
conformed,
or
and
yeah.
what it.
But I mean, we need to teach these kids why they like it, why their brains, how their brains will be affected, how they can get addicted, how they can get the wrong stuff, like
Eh,
more in than don't do it, it's bad.
Yeah. Just say no. That's magical thinking. Okay, really magical thinking with kids. So, and then to correlate that with, you were mad. Your dad came home and screamed at you, or your mom's on drugs and abandoning you, and
Or they're giving you,
or
they're
they're
offering it.
yeah.
So
And this
that's
is your
going on.
life.
Yeah.
But anyhow, at the end of that all, I got a few good questions from Ernestine Crable. She was one of my former instructors at over at Butler, and Ron asked a few, but nobody else really did. And the whole focus was on, well, we don't have the money. Basically, I think it was, we don't have the money to do that. So it never got any consideration. And next morning, I sent out an email to all of them, told them how much I appreciated the opportunity. I never ever got one response back. Now I do the seminars, for the Wichita Intervention Program. And on all day Saturday, I just teach them solely about understanding rather than personalizing substance use disorders, which is what we do. And anyhow, they always ask, why don't you teach this to the kids? Why don't you? I'm like, I've been there. And guess what? This was a response I got. And, I think they were thinking, okay, we're going to be able to do this in the health class. We're going to, PE, we're going to be, no. And Jen, I'm going to now hand it off to you for your program. But, let's just face it. Some years ago, Faces and Voices in Recovery did research discovering that 80% of the people in this country know someone in their family or person to them, close to them, that has been negatively impacted by substance use disorders. Okay. So why wouldn't we want to just dedicate one semester in middle school, was my deal, to these kids for what is life when you get the hell out of here, or so that your brain is not impacted tremendously for the rest of your life in a few years because you made these choices. I mean, if they made those choices, those are informed choices.
Mm-hmm.
They're not after that, as we know.
Right.
They're compromised
Right.
choices.
Right. Well, the program that I started at a school district locally is I worked the first year in mental health, and what I saw in mental health is that we have these resources, and if you have anxiety and you have PTSD, trauma, whatever it is, then we have all these resources, and we're going to get you community based services in the school, and you can do all this. It's great. Then what I found is, but if you have all these issues and you happen to just first get caught with THC vape in your backpack, then you're bad. Then we're no, that you're bad. We're going to kick you out of school. We're going to kick you out for 10 days. And then you're going to come back. If you get that again, we're going to take you to an expulsion hearing, and you're out. So I kind of was like, well, wait a minute.
Out of school,
Yeah.
right?
And I think,
Like
well, yeah,
out
you're
of your
out.
life.
Yeah, then you don't have an education. Then yeah. So I was like, well, wait a minute. You take two kids here. You got one kid that has anxiety, depression, PTSD. Going through some trauma. So we're going to hook you up with these services. You're going to have this therapist at school. In session 1 or 2, you're going to find out, well, he vapes THC to help cope with his ADHD and trauma, and so he's still a good kid. But then you're going to get my kid, one of my babies, and you're going to, they're going to find the backpack, with the vape in it first. And I'm going to meet with them and be like, yeah, but he's got this and this and this and trauma and PTSD and anxiety. So we got to address that.
Family issue, yeah.
Okay. Well, that's too bad. These community mental health services, they won't see substance abuse. That's bad. He's got to be punished. And so I said, wait a minute, it's not cool. So, they gave me free reins to kind of start a program. So the last 2 years, I said, okay, what if we meet these kids? When they get caught, I meet the kids up front. The admins were great. I meet with them. I meet with the parents. Say, what are we doing here? Why do we have this vape? Why are we doing? You find out things. You find out, well, maybe they have trauma that nobody knew about. They have a learning disability. They need
You open
504
up this
plan, IEP.
dialogue,
You
right?
open up, yeah, you find out. Parents, you open up that communication, so they have somebody at the school. They're like, okay, you know,
And
let's
you
talk
kind of
about
can be an
this.
intermediary
Yeah.
between the parents and the kids and
Yes, for
actually
sure.
have a
Yeah, I would get
conversation.
emails and say, Johnny snuck out last night.
Yeah,
So
and
I
but
could I
then
could engage with that.
and then later you can actually have them have a conversation
Sure.
in a respectful way,
Oh
right?
yeah. So then I got the kids in within 5 days instead of 10 days, and so I followed them. Their grades, their attendance. I met with them, pulled them out, just like I would, the school counselor pulls you out for your schedule. Nobody
Yeah,
knew. So I built a relationship with them.
yeah.
I said, "What are we doing here?" And so anyway, I that way it was great. It
Don't get
was
emotional on me here.
no, it's actually not that. But,
No, I
I
know.
built that
I get you,
relationship.
Jen.
Yeah,
I
I built
get
that
you.
relationship,
Yeah.
and I mean, it was great. And kids, I built that whole thing, that self-esteem and their strengths. And so then they didn't get kicked out of school. Majority of
Yeah.
them, they realized their strengths. They tried harder. They knew if they needed an IEP because they had a learning disability, then nobody would have noticed if we wouldn't have had this, opened up these stuff. But it ultimately came down to funding, and
I just want to
it's
say
gone.
this, and I want you to talk about funding, but, I was seeing, I had one of those kids, from there, and I remember being out there and I was at my great nephew's graduation from the high school there, and she was graduating from the complete, the alternative school, right? And I was happy for my, my great aunt, but I was so happy for her.
I
And
that
one of the teachers from the other one said, "Oh, I can't believe you're here." And I won't say what she said to her, but it was deserving. And I'm thinking, wow, what, but it was really just great to see a kid that school was able, and you was able to meet that kid where she was at, and not get all caught up on your outcome or where they are, et cetera.
Yeah, we had these kids. I could do treatment with them. I could just engage with them. I could refer them out. There's so many different things, and it was great. And it was very successful. Data showed great, great, great outcomes for the last couple of years. But it came down to funding, and the program's gone. And so many success stories.
Jen, it just was heartbreaking because, I kind of went off, but, the whole program that I was developing, the educational aspect of, understanding and teaching our kids this at a young age, combined with yours of meeting them where they're at, building rapport with them, and actually having a therapist, a confidant in all of this to keep them in
Oh
school.
yeah, keep
You
them in
know, it,
school.
it,
Show
it,
them. I mean, yeah.
it,
What are
it,
their strengths? They went into welding. They didn't know what FAFSA was to go to college when they got out. All this stuff is to help them get them jobs, help get them, give them that support.
just
I
to open
I
them.
remember one kiddo, like, he was bad. Everybody told him he was bad. He's bad, and I thought, no, because that's who I'm going to go to first. And so I can remember. I mean, and then he went to the alternative school, and what they call it alternative, but it whatever. But anyway, he towards the end, he threatened to kind of maybe kill me a few times, but we got to be buds. And
Yeah,
towards the
you
end,
believed in it.
I believed in him. I said, no, I'm not giving up on you.
Yeah.
And I always tell people, you meet people's crazy, and because we're all crazy, so we
Well,
meet people's crazy, and you don't be worse than them, you don't be better than them, but ultimately towards the end, one time he was in he then started cleaning up messes and doing stuff. And I remember one time he said, "See, I'm a good boy." Because I'd always tell him, "Oh, look at you being a good boy," just joking. And
You,
so, yeah, he
like
really,
we've always said, Jen, and I've said, the craziest thing is a kid gets caught smoking pot or doing what, we're going to kick them out of school. So we're going to ensure that there's no kid from the age of 5 to 18, if they're out of school, when everyone else is in school, right, that nothing but bad things are going to happen there. And your program was specifically designed to keep them in school. And it's just so crazy. It's that one girl is the positive reinforcement and the other is a punishment consequence.
Yeah, you got two kids.
I had a kid that was a freshman in high. He was doing good, and he was doing good in school, and he was an athlete. And anyhow, he got caught with some pot. He got hooked up, and he got arrested, and it just went on for a couple of years, and it just went insane. And ultimately, he ultimately was going into the jail because they give him 30 days because he couldn't get clean from marijuana. Well, this kid had depression. He was suicidal if he wasn't anxiety through the roof, right? And I couldn't get him my TMS therapy yet because he wasn't old enough for that insurance, but that would have helped. But anyhow, nevertheless, no, he still had, and he just loved weed, and really weed loved him. Okay. I mean, and so when he had to go to jail, he was smoking pot because he had to deal, because they got him doing just weekend. So what we're going to do is he's going to do 30 days, 10 weekends in a row. He never would get clean. I know him and another kid, they actually went to prison. They went to juvie prison from juvie, for marijuana. Okay, come on, guys. Like your model would be working with that. So now, because we're not putting our money where we should do, and folks, this is what I'm talking about with justice reinvestment. It starts at a young age. Let's change the whole direction, that this ship is going in.
Yeah. Let's engage these kids where they're at. I mean, they're at school, and this is where we have them. Let's get them there, and that was my thing. Like, let's keep them in school. Let's meet them where they're at. And why shouldn't we engage in schools?
Yeah, right. And really positively reinforce them. So then we have, the trauma informed, the mental health, the substance use, all of this stuff, is why people are doing what they're doing. They're basically, escaping a feeling to get a good feeling because, what really addiction is it empowers that, reward system in the brain, and it alleviates bad feelings and gives people a sense of well-being.
And that's what I teach my kiddos. And I've probably used this. I had a practicum student the last 2 years, and I think he heard this 1,700 times. And he'll probably use it though. But I taught these kids, and they don't know their reward system. They don't know any of that. They've just learned. So I tell them it kind of equates to being hungry. When we're hungry, our stomach may growl, we get dizzy, we get a little angry, all those, those type of feelings too. Well, our brain knows, hey, I know what's going to make us feel better. We're going to have us a cheeseburger because it's learned what makes me feel better, what calms my body, what makes my stomach stop growling, what tastes good. So it's a cheeseburger. So the same thing is just happening to these kiddos and like their THC use in school, their anxiety's high, their trauma, whatever's going on, they have now used THC. So when they're anxious, when they're sad, when they're whatever's going on, their brain says, well, I want to feel better. Yeah. I know what makes me feel better. So then they're like, well, I'm going to use THC.
Jen, it correlates into two things I want to say. One is, okay, it's a survival system telling them it has to be remembered and repeated. Now, when I do my seminars, I'm always asking this one question. I ask kids too, it comes up standard question. Why does the adolescent brain have increased sensitivity to stress every time a substance is used to relieve stress? Okay. Now, I've had people say, well, it's habituated and all this other crap, and I had a kid say to me one time, and I'm not that, but he says, Doc, I got the answer. And I'm like, okay, I'm ready. And he goes, it's like every time I get dode or I'm mad and upset or whatever, and I get dode, I'm like farming out my coping mechanisms. And I'm like, bro, that's it. And, in terms of kids, they say in the darndest things, but one time a kid came in and told me the same thing, Doc, I think I've got life figured out. And I said, well, bro, I'm old man and I don't, so I'm open to it. He said, it all comes down to doing what you don't want to do so you can do what you want to do. I said, you got the client, you got the quote of the week. But, to get more back on track here, just on the same vein you're on. So this criminal justice system that, has this disease, I was thinking about this morning, what if what if we took a person that, had diabetes and their doctor told them, look, if you go do this again, you come back, you gain weight, or you do this or that, I'm going to do something that's punitive. Okay. But I mean, we're treating this disease that we know whenever we can have a person that has a lapse and that, they have it and they grow from it. It's a catalyst and a catapult, right? And that we need to use that. We have them in the system, right? They've got the carrot and stick there. So that's what we can do to do that, okay? Goes in there and they'll say, well, nope, you're not going to tell them that because the judge, because it's against the law. It's a violation. It's a law break. You broke the law. You did something criminal you're bad. And you did something criminal when you had a lapse on this disease. Now, I'm not making excuses for people, guys, and for anyone, because just like any other condition, it is the responsibility of the patient to treat the disease in the most effective means possible. So that's what you're doing, is driving these kids over there, mental health, substance use, but you're not discriminating. Yeah, educate them.
Educate them. Why? And I often had issues with sometimes certain people in authority too. I think that we have such a stigma towards substance use being bad that they can't look at the why are they
Yeah.
using it. What's going on in someone's life, especially from 14, 15 years old, that they can't stop doing something that's causing them negative
Jen,
issues.
I'm going to answer that for you, okay? I mean, this just gives me a great opportunity to talk about, addiction, as a disease. But, 48 million people in this country have a substance use disorder. And I'd have you guess, but you'd be around that. But 10% of those people, if we had any other people that was killing more people than any other disease that was killing more people than car wrecks or gun violence, and 10%, 1 out of 10 people are getting help, we would have a public outcry, okay? We wouldn't stand for it. Now, I'm going to tell you what I think is one of my things, that this brain disease, physiologically, chemically induced brain disorder, is manifested through people's behaviors and that are misinterpreted as intentional choices, right? And that's why people are interpreting that as them being bad, because they don't understand this from the model of that this is a brain disorder. And we're talking about it. It is a biological, physiological, psychological, and sociological. And it has all those different elements, way more complex than heart disease. Okay, so this is what, and really with Justice Reinvestment, I think, I really want people, if you start from the premise of just understanding that alone, okay, that's going to give you a different paradigm mindset. Now, Jen, I want to transition a little bit over to you're recently on the Children in Danger. What's the board you've been invited? Drug endangered children. We talk about, you were asked about, and then one of the conversations came up and you told me what your response was, and I loved it. What are their barriers, right? And everybody was creating different, and your barriers, what are your barriers too?
Well, I think we were having a discussion of what are the barriers, why, what can we do to help this population, and especially with children. Well, the barriers for young children, you're not gonna, when you're, a young child, school age, you're like, don't tell anybody about mommy and daddy, or don't say anything about using drugs, because you're gonna end up, separated from us. We're gonna go to foster care. Then you got the high school kids. Well, we're not gonna talk about we have a problem, because then we're gonna get kicked out of school. Then we're gonna, whatever. We're not gonna, when we're older, we're not gonna talk about it, because we're gonna get arrested, because then we're an adult and we're 18, and then we're
So
gonna.
this is this crazy
So
system.
we can't talk about it, and so nobody needs to talk about it. So there's the barriers, there's, and then that we treat it, working. Quick story about when I worked in law enforcement. The mentality back in the day, was, I remember there was a cop, and he was a big cop. He was a big guy, and I can remember standing there, and he said, "Well, I just think anybody that gets arrested twice for drug offense or DUI, I mean, their kids should just be taken away from them. They're just pieces of horrible people, and because they've decided that they could kill somebody or kill themselves or overdose, or we could do whatever. They don't care about their kids, and da 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 da, because they could die or go to prison."
Just simple
And I
solutions
said,
to
yeah.
complex.
And I looked at him and I thought, because he was, like I said, he was a bigger guy. really bigger guy. And I said, it's kind of like weight loss. I said, I would assume it's like an addiction. And I said, because we could say the same thing. Well, how do you not care about your kids? Why don't you lose weight? You could have a heart attack. You could do,
Die.
yeah, and you're not doing anything about it. So therefore, you don't care about your
It's
kids.
intentional behavior.
Yeah. So you don't care about your kids because you're eating, food, and you could die, and you could, all this
In
stuff.
the face of catastrophic consequences that you're just ignoring.
Yeah, you're just ignoring it. And that's why I kind of thought, we talked quickly about, all the GLP-1 stuff coming out, because, oh my God, all these people have this food addiction and they can't stop. So we got to give them medication. So we got to make them healthier, and look at us because, they can't help it, and because it is, it is, it's the brain. But addiction to THC or addiction to alcohol, they're bad. Still bad.
And it's their choice.
Yeah, it's your choice. They're choosing to do this.
Dr. Nora Volkow, whom we both love, she has a TED Talk, if anybody get a chance to watch it, How Our Brains Get Addicted, okay? And what it's really about is she does a correlation with people that are morbidly obese with people that are have severe, substance use disorders, right? And she shows that part of the brain, right, those cellular levels in the D2 dopamine receptors, and through CAT scans and post-emission topography, PET scans, and shows how they have almost identical, just different, but low levels of dopamine, right? D2 and that's what drives the person to continually replace.
Brain tells us what makes us feel better, and what relieves our pain, our fears,
it's not,
whatever it is.
And it's not conscious.
No,
it's
like telling that there's like when you're hungry, you can't just say when your stomach's not hungry no more. Never mind. That's not how that works. And when we don't
think you're in a state of deprivation.
Yeah.
With food, it's the same.
The brain learns what's good and bad for it to make it feel better. And it's like a hot stove. We don't have to put our hand on a hot stove every day to know that we're not supposed to do it. The brain remembers, and the brain remembers what makes us feel better, and or feeds our stomach. Or we don't say, well, we're not going to take an Advil because we have a headache. But our brain says, hey, I have a headache. Maybe I should take an Advil, because the brain's learned what makes me feel better.
Well, this, like drugs are 2 to 10 times more rewarding than our best natural rewards, okay? And so, like, there's no comparison. When you really look at that, what if something... So when I was in the drug court, which I've talked about before, and that's part of my Justice Reinvestment, goals and motivations and paradigm, is, Judge Kisner asked me one time, we were having staffing, he says, Peter, why is it that, these same people can go to jail for 4 or 5 days or a week or whatever, and then get out? You talk about the reward of that, but don't they get that? And I'm saying, like, well, Judge, it's an intervention, and, at a shorter level, it's effective. At the point of diminishing return, it isn't. But anyhow, I said, it's because that's wired into their brain as a matter of survival, and that it just remembers that the same way that one of my patients last night was telling me at 45 years old, he did 200 milligrams of Adderall, and he's still trying to get the high he used to get when he did 20. Okay. And the brain's still saying that is crazy, right? And so, but really, Jen, the part I overlooked that I got the research later on when I learned about the memory bunts on the dendrites of the dendritic spines of dendrites, and these huge memories that were compared to childbirth in women, right? That's how they discovered that. Well, this is what, with the frequency and the amount, that's what drug memories were, right? And so what that is tied to is their survival system. And I didn't say that because, if you take something that's 2 to 10 times more rewarding and then it's tied. Now, I know that some of you out there listening thinking, well, yeah, Pete, that's bullshit. You're sitting here making up excuses for bad behavior, and I don't want to come across that way. I'm just so emphatic about it because Jennifer and I work with people that we watch. Ultimately, we see this happen in front of us, and it just spells out the story. And this is why, changing this criminal justice system, the way we're talking about with, I know how much of a fan you are, like I am, with marrying law enforcement, and our police officers, like the ICT Wichita teams with the EMS. You worked in the hospital, you love that audit, and then you had the social worker there. And then I don't know how many patients I see that if they would have been present at this would have taken a different trajectory, because then we're like having a rational discussion, not like some used to have at point of arrest, right? In the day, right?
Yes.
You're having it right here. And what is this person? They have schizophrenia. Okay, we really don't. This isn't going to be a good outcome. Okay, so what do we want to do, and how can we? Really, the question I always say with this is, how can we most effectively, and it happens to be efficiently, help a person change their behavior? How can we help? And it's all these other things about seeing themselves differently, understanding why they're doing what they're doing so they'll have more control over it, going back, dealing with your childhood, dealing with these difficult issues.
Fix the issue that
Yeah.
it all. Let's go back and work
Go
on the
back and work on
original.
that.
Yeah.
Yeah. Go back
Yeah.
and address
Yeah.
that and say, okay, here's where
And
this.
again, that goes back to individualizing with the individual. What each person, what's going on with it.
Well, Jen, I'm going to bring some more work your way, okay? But, like we have, I do the DEI program out there, and we have a lot of people that I get there. They've been in recovery. It's 2 years later, they're out there, right? And so you get people that come to you for an assessment 2 years later, right? Well, they've already, like a kid the other day, he had already done well. And I said, no, Jen won't put you in a group 3 hours, 3 times a week. She'll tell you, keep seeing your therapist. You're in recovery. I mean, you're doing good with your life. And by the way, he doesn't meet criteria. He's in remission. He no longer meets medical necessity for that disorder.
Yeah, I actually had a kiddo that first time DUI that was told during his initial intake elsewhere that he needed 6 weeks of counseling. And I said, well, why? This doesn't really make sense. And he said, well, they told me because I refused my BAC during my arrest, my blood alcohol, the test, that I needed to go to 6 weeks of treatment. And I was like, it angered me because I'm all about rights. And I said, no, that's your right to deny that. It doesn't matter. You could be,
and you're a former cop.
yeah. And I'm all in and I said, no, and I think that it goes back to the checklists that so many times people use. It's a checklist of, have you had a DUI? Well, then you must have a problem. I mean, if you have 2 DUIs, I mean, you're obviously need inpatient, and it's like, no, like there's,
I mean,
you could have drank 2 times in your life.
Yeah.
It's
well,
just,
where's
they
the
don't ask the question.
It's like I look at so much of it. It's the punishment aspect of, like, even a guy right now. He's a professional person. He has a real problem with weed, but he also sometimes drinks and drives. And over 15 years, 20 years, he's had 3 DUIs. Okay. Well, now he's in recovery and he's doing really well. But on top of that, so what he has is, because he didn't blow somewhere, he has to have in his car. He's got a 1-year-old daughter now, or 6-month-old daughter. He's got to have in his car for 5 years this freaking device that he's got to blow into. Now, I'm a big fan, because I tell people, look, that's helped people. A lot of people that have had them for a year or so, it's helped them understand, never drink and drive. You got in that car and you should never, ever put somebody else's life in danger, yours, but somebody else's. And, I'm a real passionate about this, as you can tell. But, okay, they get it. So what's the rest of it? $1,200, it's going to cost him, I don't know, 15,000, I mean, however many thousands of dollars over all these years. And really the bottom line is, Jen, what is the point? Okay, what does it take to change behavior? Like my friend Nancy, is a former assistant, a warden, right? And she just watched working in the criminal justice, as a warden, youngest warden ever of a maximum security prison in the United States, Dr. Nancy Insko, said, after 11 years, I said, what the hell am I doing here? I'm taking people and making them a de facto criminal. This is a de facto mental health institution. And we're not getting people better, and that's that whole craziness that you heard me talk about a lot, is the adversarial relationship that we create with law enforcement and our population that they serve.
Yeah, we got to work. We got to work as a team. All of us, a team. The social workers, the medical professionals, the law enforcement. We all got to be on the same page. And I think education's important.
I think you couldn't have summed all that up better. That's what this all brings it back to. I get on my soapbox. My people in group watch me do that. But, really, the truth is, It's just a real passion that we both have. We can do better. We've got to do better, and we need to change the face of the criminal justice system. And, that goes all the way into our school system and all these other different levels of our society. So that's why this podcast is about justice reinvestment. And that's what we call it. It's really reinventing and reinvesting in that reinvention of our criminal justice system. So everyone, I want to tell you, I'm really looking forward to the next podcast next month. I'm going to have Liz Orman from NeuroStar TMS. It's transcranial magnetic stimulation for treatment-resistant depression. It's about 80% of the people that do this treatment end up getting a 50% reduction, and 60% are in remission, okay? So we're coming to learn a lot more about that. It's non-invasive, it's non-pharmaceutical, and it helps change lives and save lives. So that's going to be Justice Reinvestment next month. Thank you all for watching. So much appreciated. Love to you all.